Hi, I'm Dr. Pauline Hoang, and I am a naturopathic doctor at Ann Arbor Holistic Health, and I'm going to be here to answer some of your questions. So it's interesting. There's lots of research that shows that there's a huge link between digestive function and the development of uterine fibroids. So H. pylori is a bug that specifically is found in the stomach and has implications around the acidity of your stomach acid. And when we find that there's a chronic infection with H. pylori, there's a higher tendency towards development of fibroids, whether that be associated with the inability to properly digest and absorb foods, or that the bug is digging, deeper into the stomach lining and all that, is still to be debated. But there are huge, relationship connections between your digestive function and the development of fibroids. Yeah, so depending on where the fibroid is in the uterus or surrounding tissues, it can press up against other body structures in the surrounding areas like the small intestine, the colon, the rectum particularly, and can cause issues like difficulty passing gas and constipation. So it can interfere with your normal bowel movements. Yeah, the fibroid size and the location of the fibroid can determine what kind of symptoms a woman experiences. So if a woman has a fibroid on the outer uterine wall, or those that are close to the GI tract, it can cause digestive symptoms such as constipation, gas, and bloating. So the bigger the fibroid, typically, the more issues that we see. Absolutely. Definitely, the higher the amount of inflammation in the body, the more likely that you're going to develop some sort of fibroid issue or some sort of hormonal issue. So things that we can control, things like diet and hydration, making sure those are, you have those foundational pieces down, that you're eating foods that are not triggering your system, that are providing the proper nutrients for your body to function, that you're making sure that overall digestion is optimized, can really minimize your risk for the development of fibroids.